Hello and welcome to another series on SYNLAB podcast. Today we'll begin a new and rather riveting topic titled Active Balls, Maintaining Prostate Health. My name is Pasty Mokungah and I'll be your host. I'd like you to remember to like, comment, share and subscribe to this podcast on YouTube and Spotify so we could have the opportunity to keep bringing you engaging and informative content just like this one. Aiding us in unbundling and unraveling today's topic is the extensively achieved Dr. Habeebu Muhammad.
Thank you for having me.
It's nice to have you here. I'm very, very privileged to be having this discussion with you.
Thank you.
Now, before we start this discussion, I'd like to introduce you to our audience. And in doing that, I'd like to read your very, very impressive profile. It says here that Dr. Habeebu Muhammad obtained his MBBS in 1996 and completed residency training in clinical and radiation oncology from 2000 to 2007. Throughout his career, he has held various leadership positions at Lagos University Teaching Hospital, popularly known as LUT, including Chief Clinical Coordinator and Head of the Radiotherapy Department. Currently, he serves as the lead oncologist for the NSIA LUT Cancer Center, reflecting his dedication to advancing cancer care infrastructure. Dr. Muhammad is actively involved in medical education, lecturing at the College of Medicine and mentoring resident doctors in radiotherapy procedures and radiobiology. His research focuses on the challenges of cancer treatment in sub-Saharan Africa, with particular emphasis on the advocating for the integration of pediatric palliative care. Wow. In addition to his clinical and educational roles, Dr. Muhammad participates in various training programs, observerships, including those facilitated by the International Atomic Energy Agency, IAEA, underscoring his commitment to continuous professional development and international collaboration. His multifaceted contributions encompass clinical care, education, research, and policy advocacy, all aimed at enhancing cancer care services and outcomes both locally and globally. I'm very, very pleased to have you here with us to discuss this topic, sir.
Thank you.
Okay, to start us out, I'd like to ask, what is the prostate and why is it important to men's health?
Okay, the prostate is one of the organs that really makes a man, because the prostate is a reproductive organ, and the major function of the prostate is to produce semen for sperm. The prostate is located at the base of the bladder, and the urethra takes the urine from the bladder through the prostate and to the genital. So the prostate gets bigger with age.
Oh.
Yes. And usually most of the problems that comes with prostate will come at a later age.
At a later age, why?
Because it keeps growing and it's functional, and a lot of activities that involve the prostate comes later, that's after, like in the adult age.
Okay.
Yeah.
Okay, so what are the most common prostate issues that men face?
So we have three most common issues.
Okay.
We have prostatitis, which is more of an infection or inflammation of the prostate.
Okay.
Then we have what we call benign prostatic hypertrophy, which is more like the enlargement of the prostate, but non-cancerous enlargement. It's
okay,
just
that's why it's benign.
Benign, yes.
Okay.
So with that enlargement, it compresses on the urethra that I said passes through it, and it usually will obstruct the flow of urine. So most of the signs and symptoms of BPH are signs of obstruction of the flow of urine.
Does it cause pain?
It can cause pain. When it's obstructed, we can have urinary retention, difficulty in passing urine, and it can even cease. There are a lot of other symptoms that are come from that, like infection, and it can be problematic.
And
then
the third one?
The third one is the cancer. The prostate cancer also comes with age, just like benign prostatic hypertrophy. And in addition to the symptoms you see with benign prostatic hypertrophy, you can also see blood in urine when it's prostate cancer. And if untreated, there could be spread to other parts of the body. Exactly.
I think this is very educational because I feel like most people don't know that there are other things that could be wrong with the prostate besides cancer. We've heard about prostate cancer, but we've not heard about benign prostate
hypertrophy.
Okay, yes, and the other one. So I guess it will help with the fear. Some people might be afraid that if anything at all is wrong with their prostate, it's cancer. But it's not always cancer,
no,
like what you just said.
Benign prostatic hypertrophy and prostatitis, they are more common than cancer.
Oh, interesting.
Yes.
Nice. Okay, so how do prostate problems affect the overall health and quality of life for a male?
Yes, when there's problem with the prostate, the main function of the prostate, like I said, is reproductive. So we can have problem with the prostate resulting in, reproductive problem like inability to impregnate a woman, like inability to have erection, inability to have sound coitus, that sound meeting the sexual activity. And this can also lead to lowered morale because, if all these are impaired, the man is naturally going to have low morale and is going to impact on every other thing he does.
Okay. So to avoid this, what are the early warning signs? What should the man look for very early?
Very early, the stream, the urine. When you are passing urine as a man, normally you shouldn't have pain. So by the time you start having painful urination, you know that there's something wrong. Then also there may be pus. If it is infection, there can be urine mixed with pus. There can be hesitancy. Hesitancy meaning that when you get to the place to pass urine, you are free to pass urine. Also because of pain, there could be poor stream of urine. As the person gets there, the urine is very low. The stream is low. And then we can also have what we call frequency. Because the person's prostate is large, is not allowing complete emptying of the bladder.
So you'd have to go many times?
Many times because it gets filled up, and then he goes to the toilet again, gets filled up, frequency, we call that one. And in the case of cancer, there could be blood because the prostate cancer can infiltrate the structures around it, infiltrates the urethra and leads to blood in urine. Okay,
so blood in urine, it's only cancer that can cause it?
No, there are a lot of factors.
Okay.
Like I said earlier, prostatitis, even STD, sexually transmitted disease, and then there's this schistosoma, we call it. There's a worm usually that some people can take with water, drink, and that worm can cause blood in urine.
Okay.
However, prostate problem can also cause blood in urine.
So that's something somebody should be worried about.
Should be worried about. It's not exclusive to prostate, but prostate can also cause it.
Okay. So with all of this, I feel like we've already answered this question, but I want you to be explicit about it. Why is it important for men to take their prostate health serious?
Well, it's very important because if there's a problem with the prostate and it is not taken care of in due time, it can lead to infertility, it can lead to other, factors, other common, factors like difficulty in erection, erectile dysfunction, and if it is cancerous, it could even lead to loss of life.
So this rather small gland seems to be very, very important.
The gland is very important because for every man, as you are growing old, the gland is getting larger, and the chances of having cancer also comes.
Why does it enlarge, though?
Why it enlarge? Well, I cannot say specifically, but I know testosterone is part of why it is enlarging because we know that only the men that are castrated when they are young, they are the only ones that do not develop BPH, and they are the only ones that do not have prostate cancer. As a matter of fact, statistics have shown that For men that are up to 80 years, about 90% of them has BPH, and about 80% of them has prostate cancer. But fortunately, most of the prostate cancer are not aggressive. So it's only about 20% that is aggressive, and these are the ones we see.
Wow, so you're trying to say majority of older males
Majority, yes.
will have
We
an
have
issue,
this.
one prostate issue or another.
Exactly.
You mentioned something about the correlation between castration and prostate
cancer. Both cancer and benign prostatic hypertrophy, the only way you can prevent them completely, you can assure that the man will not have it, is to castrate the man as a boy. So, and nobody will agree to that.
Nobody would agree to that. Well, this has been very educative thus far. So far, so good. We've learned that there are other issues that can go on with the prostate beyond just prostate cancer. We've also learned things that you should look out for, including strong stream of urine, such things as pain. Right? And you mentioned pus too. I remember that. And also that the prostate gland seems to be very important. I didn't know before today that it grows as a man is growing. So that's very nice. Okay. This has been such an educative session, even for me, and I'm sure our audience too has been well educated. I'd like you people to stick with us because we have more coming your way. Don't go anywhere. And remember to like, share, comment on this, and subscribe on YouTube and Spotify. We'll be right back continuing this session.